A small summer surge of COVID cases, relaxed mask mandates, and the emergence of new variants have left people wondering when to schedule their next vaccine. Dr. Christopher Longhurst puts the spike into perspective.
It's really, insignificant kind of in comparison. We're talking about 30 patients, in the hospital, not 185 or 200 patients.
He says the last time COVID was the main cause of hospital admission was in the summer of 2022. The CDC recently recommended anyone 6 months and older receive one of the new COVID-19 vaccines, expected to become available this fall, regardless of prior vaccination status. Longhurst agrees.
If you've had a booster in the last year, that should be helpful in terms of protecting you. That being said, people who are at high risk for serious disease because of age or immunocompromised status or other should certainly be cautious and careful when being out and about.
He says not to get overwhelmed with the emergence of new COVID variants.
Remember, all of these subvariants that we're seeing circulate now are really subvariants of Omicron. And so the booster has been effective in helping to prevent serious illness, and the annual updates are targeted to the subvariants.
Longhurst also says with the rise of new variants, some at-home tests are not quite as accurate as they used to be.
So testing at home can be helpful if it's positive, but if you're negative, does not always rule out the presence of COVID. And if you're really concerned, testing in the doctor's office can be helpful.
Free COVID testing will be available at 3 county public health clinics located in Chula Vista, El Cajon, and San Diego. Heidi de Marco, KPBS News.